If your knees feel stiff, ache, and creak while you walk, then you're like millions of other Americans.
But now, a new procedure just approved by the FDA may soon bring relief by restoring lost cartilage. CBS 2's Dr. Max Gomez introduces us to the first patient to undergo this procedure. Dr. Max.
Well, you know, that's right. Those stiff, painful knees are usually due to osteoarthritis, loss of cartilage on the ends of the bones from wear and tear, injury, or sometimes disease. It's the leading cause of total knee replacements. So doctors have long sought ways to replace that lost cartilage. Here's the latest approach. Chris has had problems with his knees for most of his life. The 33-year-old suffers from a rare condition called osteochondritis dissecans, which causes cartilage in his joints to break down.
It was quite painful. Sports were difficult. And then walking became an issue.
Chris, who prefers not to use his last name, was too young for a total knee replacement, but was a candidate for a new technique called matrix autologous chondrocyte implant, or MACI. Chris's own cartilage cells were grown in a lab and placed onto a collagen membrane. His surgeon at Brigham and Women's Hospital in Boston cut the membrane to size and filled defects in Chris's knee cartilage, much like filling a pothole. Over time, those cells grow and develop into mature cartilage.
We can just basically template, cut, and paste the membrane that's already preloaded with cells into the base of the defect and just glue it there. And so that makes it technically much quicker, much easier.
The technique has been used overseas for years, but was just approved in this country in December. Chris is the first patient in the U.S. to have it.
Lift it up. Awesome.
For Chris, who has had many surgeries before, MACI was almost a breeze.
It's been very easy comparatively.
He's looking forward to getting back to his daily activities pain-free. Now, the MACI procedure could be used to treat the many thousands of osteoarthritis patients who suffer from cartilage loss in their knees. Patients can return to most activities within 1 year and impact sports by 18 months. Most insurance companies are expected to cover the surgery. So, help for those of us with aging jock syndrome.
Yeah.
Game changer.
Yeah, I hope.
Hopefully. Thank you.
Thanks, Dr. Max.